Good night and welcome to Benalmádena's first English news broadcast. Digital Costa del Sol brings you every Friday all the information about this week's news. On Benalmádena, almost 30% of our population are foreigners, so it is important to be able to care for them during this crisis, for which help hotlines have been organized in the area of foreign residents.
Benalmádena City Council continues with its effort to respond to the different situations provoked as a result of the coronavirus health crisis. At the beginning of April, the foreign residents delegation, headed by the mayor Victor Navas, launched 2 hotlines for assistance to the foreign residents, where our citizens can solve their questions in 7 different languages: Spanish, English, French, German, Danish, Polish, and Russian. The numbers are 952-442494 and 952-441295, and the operation hours are Monday through Friday from 9 a.m. till 2 p.m. In addition, the delegation can also be contacted through the following emails: residents@benalmadena.es and turismo@benalmadena.es. Navas speaks about on this video sent from his office at City Hall.
This is a message to all our foreign residents. As you may know, 30% of Benalmádena's population are foreign residents, and I hope you are safe at home. If you need something from your town hall, it is open every day. You have 2 phone numbers available in 7 languages. In case you don't know those numbers, go to our website. Remember, stay at home, stay safe, and all together we'll beat the virus.
Since they start the service, an average of 10 calls and 15 emails are being served each day, which makes an average of 25 queries per day. Most of the queries are related to social assistance, administrative procedures, displacements, issues during the state of alarm, and renewal of documents. The foreign residents are also offers updated information in English on the state of alarm and the measures taken by the City Council on its Facebook page, Benalmádena Foreign Residents. On Benalmádena, almost 30% of its population are foreigners, so it is vitally important to put resources at their disposal so all the necessary information is available for them and they do not feel abandoned during the situation generated by the alarm state.
Benalmádena City Council acquired 4,000 new surgical masks and 2,000 FFP2 type to be used by essential workers such as the fire department, local police, civil protection or operational services.
The Emergencies Councilman Javier Marín reported last week on the acquisition of 6,000 new protection masks by the City Council of Benalmádena to strengthen the protection resources available to essential services workers of the municipality. These new masks, 4,000 surgical and 2,000 FFP2, will be used for the use of fire squad, local police, civil protection, operational services, social welfare, and in general all those who continue to serve the public. With this acquisition, the City Council has covered, within a period of 1 month, the needs in terms of personal protective equipment for its workers in the emergency area and other essential services during the COVID-19 pandemic.
Desde el área de emergencia del Ayuntamiento de Benalmádena,
the emergency area of Benalmádena City Council, in collaboration with the area of labor risk prevention, has purchased new individual protection equipment for municipal workers. Specifically, there are 4,000 more surgical masks and 2,000 from the FFP2 type, apart from those that the consistory already had. With this, we want to give all municipal workers the necessary means of protection so they can continue developing their work for the whole population of Benalmádena. At the same time, I want to thank the implication that everyone is having in these difficult times for the population, continuing with a public service that, from the beginning, we understood to be essential.
From the consistory, they announced that they will continue working on the acquisition of new personal protective equipment to guarantee supply in the future. To receive the mask, the heads of each department should contact the municipal area of occupational risk prevention and request them, with their distribution organized from the emergency area. In addition to this acquisition, the City Council received 3,850 masks last Sunday, provided by the central government, and which were distributed on Monday 13 and Tuesday 14 among users of public transport. Gloves, alcohol, and face masks have become the essential kit for ordinary citizens to combat the coronavirus. A few days ago, the Ministry of Health recommended that the general population use hygienic or surgical masks when traveling to the workplace.
Social Services continue with its effort to reach all vulnerable families in the municipality, and now they have signed a collaboration agreement with Red Cross and ASIS to coordinate their work.
Benalmádena's Mayor Víctor Navas and representatives of Cruz Roja and ASIS local groups have signed a collaboration agreement to provide both associations with the necessary means to guarantee immediate care for vulnerable people during the COVID-19 pandemic. An agreement that includes a series of measures aimed at alleviating the serious situation that the most vulnerable groups, such as elderly people and individual or families who have problems satisfying their first-order needs, are suffering due to the measures of confinement of the population. City Council also proposed the representation of Caritas in Benalmádena to join the agreement, although they finally declined to sign the collaboration, something the consistory regrets, since from the City Council they proposed the idea with an integrating vocation in order to join efforts in support of the most disadvantaged. The agreement will serve to establish a coordinated work system to develop social assistance in a common way between the City Council and the associations, thus preventing each group from carrying out their work independently and uncoordinated. City Council will process the granting of direct public aid to Cruz Roja, the local assembly of Benalmádena, in order for it to articulate a series of actions to provide for the basic needs of people and family units in need residents in the municipality as a result of the current pandemic situation. Users will be referred by social welfare through a technical prescription report prepared by a social worker. The collaboration includes actions such as direct delivery of food, basic hygiene products, and cash cards to make purchases of basic necessities. In addition, the City Council will make available to the Cruz Roja food and other essential products from food banks and private donations to the corporation for its distribution among family units in a situation of need, which must be distributed according to the technical criteria for referral prepared by the social services technicians. The agreement signed with the Cruz Roja Benalmádena also undertakes to include those individuals and families referred by ASIS, who will refer to social services if they are users in an illegal situation in Spain, and to the Cruz Roja when it comes to people whose stay in the municipality be irregular. The agreement includes the creation of a mixed commission for monitoring and evaluating this agreement, made up of 2 representatives from each of the signatory parties, with the City Council representing the Councillor for Social Welfare, Alicia Ladaga, and a technician from said delegation municipal. The collaboration agreement will be valid as long as the situation of social need derived from the pandemic by COVID-19 continues.
All over Spain, the hospitality industry is looking at this crisis with fear and uncertainty. On Costa del Sol, business owners estimate their losses in around 270 million and predict the destruction of 80,000 job positions.
The current state of alarm caught everybody by surprise, with storerooms full of supplies and a large staff preparing for the start of the forthcoming peak season for hotels and restaurants. the absence of tourists and the need for social distancing measures that will have to be implemented before normality returns are going to make recovery especially difficult for a sector which is already predicting losses of millions of euros on the Costa del Sol. Beyond the uncertainty of not knowing when they can reopen, the drama for the restaurant sector can be summed up by the cold, hard numbers. Business owners estimate about 270 million euros in losses, and 80,000 people are currently without work in the province of Malaga. In fact, the bar and the restaurant sector accounts for about 30% of all the ERTEs registered in Andalucía. According to the most optimistic calculations by the Restaurants Association in Malaga province, bars and restaurants will be the last to recover from the coronavirus crisis, and it will be at last 6 months after they see their premises and outside terraces full again. Some restaurants owners believes that Spain and other countries affected are going to follow the same steps as China, where normal activity has still not resumed despite the restrictions starting at the beginning of the year. There are information about restaurants in Hong Kong that have had to restrict the number of customers by 50% and are not permitted to sit more than 4 people at a table. The majority of professionals in the sector knows the turnover is going to be badly affected and warns that numerous companies are going to suffer. Business will manage for the first few months after lockdown thanks to the eco-credits for entrepreneurs, but many will probably be forced to close down. There is a general belief that this summer will have to be written off and professionals would be pleased to start working again in September or October. Business owners expect to be closed this summer, and they estimate that it will take at least 6 months for the sector to start to recover. The Chiringuito Beach restaurants are also reliant on tourism, and they are extremely worried by this crisis. The president of the Association of Beach Business in Malaga, Manuel Villafaina, says this is a profound crisis for this sector because even though a business is closed, it still generates expenses. Like the others, he believes this year is lost and that the only solution will be to apply for loans. Before the crisis began, around 50% of the clients in the city center establishments were from outside Malaga. So it will be essential to adapt and reformulate their business to the circumstance.
Since the health crisis started, more than 200,000 citizens have tested positive for coronavirus in Spain. Almost 12,000 of those cases are in Andalucía, with around 3,000 of them in our province.
On Wednesday, for second day in a row, the Regional Ministry of Health didn't report a single new coronavirus-related death in the province of Malaga. The official report on Tuesday showed the total number of people that died after testing positive for COVID-19 remains at 223, the same as on Monday and Sunday. However, it is possible that deaths that occurred over the weekend were not reported yet. What's more, on Tuesday, only 6 new cases of COVID-19 were confirmed in the province of Malaga and 15 were reported on Monday, bringing the total to 2,552. By Tuesday, 877 people in the province had been given the all-clear. In Andalucía, the Junta confirmed 134 new cases of coronavirus, 11,689 in total. Currently, 1,173 patients with COVID-19 remains in Andalusian hospitals, with 277 of them in UCIs. 4 new deaths were reported by Wednesday across the region. Nationwide, the picture is not so positive, though this can be attributed to the weekend lag in figures sent from the autonomous communities. There was a new spike in coronavirus-related deaths. 430 new deaths were reported on Tuesday, 31 more than the previous day. This increases the total number of deaths in Spain to more than 21,000. Despite, once again, rising above 400 deaths per day, the daily increase is just 2%, compared to 3.2% a week ago or 5% 2 weeks ago. Likewise, with the number of those testing positive, 3,968 new cases were confirmed on Tuesday, a daily increase of only 1.9%. Since the health crisis began, more than 200,000 people have tested positive for COVID-19, according to the figures provided by the autonomous communities. We knew that increasing the number of tests would increase the number of confirmed cases, and we knew that this would put in a compromising position when it came to reporting them. Fernando Simón, director of the Center for Health Alerts and Emergencies, explained at a press conference on Thursday. I think it's good news that more than 40,000 tests have been performed in the last few days. This doubles what we were doing to the previous weeks. We are making a big effort across the country to identify and isolate all those cases that could be dangerous for the rest of the population, he said. While this number continues to grow, so does the number of patients given the all-clear, which now totals 74,797, 40.9% of those who have contracted the disease. Between Wednesday and Thursday, 3,944 people were discharged, the highest daily figure during the pandemic so far.
And these are today's headlines. New help hotlines for foreign residents. City Council acquires 6,000 new protection masks. New municipal agreement with Red Cross and Assist. The hospitality industry faces their hardest year. Death count slowed down on Málaga. The weather forecast for the weekend will leave us with cloudy skies or cover with occasionally stormy rainfall, without ruling out that they are locally strong. Minimum temperatures with little change, descending heights. Winds from the east component in the eastern Mediterranean and weak variables in the rest, turning in the afternoon to the west component in all areas. And that's all. Thanks for watching us, and remember, you can stay updated on our website or social media profile on Facebook and Twitter. Have a good night, enjoy the weekend, and remember, stay at home.